the fundamental fact, let me tell you that what you have even stated is the ratio in urban cities, in urban areas. When you talk of rural areas, you may be talking of 1:9,000. You talk of these areas where there is banditry and terrorism, you may be 1 in 20,000 or more. So we agree it is dire. But what we are saying is that all the logic being presented does not make sense. If everybody is being subsidized, then you cannot in a discriminatory manner hold down to a few people. All that we have come to realize is that doctors are important, just like other healthcare workers. And the solution is to make a man that is important to feel that he belongs to you. It's like looking at a good footballer in your football team and you clamp a band that he cannot leave. You cannot do that. And let me also point out that the basic issue of subsidizing of our education, we need to look at the quality of education we're even subsidizing. I thank God the analyst said that his son is in a private university. As those that their children are in public university, many of them are paying for private residence outside the hostels that nobody can sleep in. Many of them pay for transportation of their children for clinical practice outside. Of course, you have to feed your child outside in a different manner. So government say, oh, we have subsidized tuition, but I'm feeding the child.
But President, so this actually takes me to another area that I'd like you to touch on. And it gives me a good premise before I go to Senator Olori Egbe. Now, the fact is, there are things that are enticing your colleagues, making them to run out of Nigeria. What are these things?
Of course.
What are these things? Can you list them to us?
Yes, so when you discuss brain drain, you look at the factors based on two groups of factors, what you call the push factors and what you call the pull factors. The pull factors are those things that are outside that are making them to go, which is not within our control. While the push factors are the things within our control that are pushing them out of Nigeria. The first push factor is poverty. Poverty is the first push factor. Let me tell you, a new trainee doctor in NHS is earning about £40,000 per annum, while our own is earning about 3 to 3.6 million per annum. If you break down about $40,000 per annum, you get an average of about 2.5 to 3 million in a month. So the French doctor in Nigeria earns in a year what the French doctor in UK earns in 1 month, and you want him to stay. Let me tell you, the taxation policy since 2014 have been taking a lot of money out of the pocket of the doctor, taxing his core duty, taxing everything. We are treated like we are common, and then they cry that we should be held hostage. Okay? Second issue is the insecurity. Doctors are being targeted. I'm sure you know about Dr. Uyi Ilobe, who was murdered at Ohara on 29th of December 2022. The murderers, the major culprits are still at large till today. Recently, violence against health workers and doctors have become a common thing. There are some happening everywhere. Maybe the level of anger in the system has made our patients and their relatives to be violent towards us. Of course, lack of equipment. And our hospital facilities are dilapidated. The hospital, some people think that making a hospital beautiful, planting flowers, creating a comfortable common room where people can stay and work is luxury. It is normal. It should be given. And of course, even in the rate of the fact that doctors are leaving, some are still not employed.